It's been exactly 12 months since I started taking Mounjaro, and I never thought I'd be in the situation that I'm in now. So today I want to explain exactly what that is. I want to talk about some of the common pitfalls for people who've been on these medications for a little bit longer, and I want to share with you my exciting news and what I've been up to over the last few weeks. First, let's talk about maintenance. If you've ever been on a diet, somebody has probably said to you that losing weight is hard, but maintaining that weight loss is even harder. So when it came to GLP-1s, I wanted to know how people were doing this differently. And I've been looking at clinicians all over the world and how they're approaching maintenance with their patients. And so commonly the approach is get them to weigh themselves regularly, keep them accountable, keep them focused on keeping that weight off. And it almost feels like you've committed a crime of being a fat person and must forever be accountable to that. And I know that's not what it is. I know that's not the way it's intended. And this may be necessary for some people, given whatever their underlying causes of obesity are. But for me, the ultimate goal of being on these medications isn't just about the smaller body. I keep putting down the smaller body aspect in my videos, but it is a big deal. It does make a big difference. And it is wonderful, but it's not everything. And actually, the bigger win is to free yourself mentally from the mental aspects of obesity, the constant checking your food, the constant obsessing over your body size and weighing yourself, all those things. And what is so exciting to report in today's video is that I didn't realise that I had achieved that a few weeks ago. I was out for dinner with some friends and they were just being very complimentary as to how I looked and talking about my body, which they meant really, really well. And they said to me, "How much have you lost now in total?" And I realised I didn't know because the batteries went in our scale a few weeks ago and I haven't replaced them. And they said, "Oh, you must be dying to know." And I thought, no, not really. I'm actually not that bothered about how much I weigh on the scale because when I wake up every day, I feel happy in my body. And they said, "Do you worry about gaining weight back? Do you feel like you're monitoring for weight regain?" And I said, "No, I don't really think about it." And then they asked me how many calories I was eating a day. And again, I wasn't really sure. So they asked me what my approach to food was. And I don't have any food rules whatsoever. I eat pretty much what I fancy, but also mindfully, I really try and think about what I'm eating and have I eaten enough of different things. And I'm really trying to incorporate more and more different foods into my diet and eat as many veggies as I can. And so I eat to really nourish my mind and my body and feel like it's indulgent, but I don't really have any restrictions whatsoever. And when I was sat there, I just suddenly realized that I'm not even trying. I'm not even trying to lose weight. I'm no longer part of all this diet culture stuff. It's all completely gone and it is so freeing. And it was a real moment of both extreme excitement because being free of that stuff is as big as losing the weight. But at the same time, there was a little bit of sadness because this has been a lifetime battle. Trying to have a really relaxed and healthy attitude towards food and my body has been a lifetime in the making. And I sat there and realised that there was no fanfare, there was no party, it was just kind of a quiet contentment. And as great as that was, I wanted a party. And it's so nice to know that you can get to this point. So many people that I see talking about being on these medications for longer are exhibiting a lot of really quite eating disordered views and are really obsessed with their body in a way that I don't think you have to be, which I do think we can guide people away from. But while you're on these medications, whilst you're working on the body, you also have to work on your mind. I talk to a lot of people who've been diagnosed with ADHD and autism as adults. And what is a really common thing to hear in these patients is them say things like, "Oh, I wish I could go back and tell my former self not to worry about all these things that were so problematic and not to blame yourself for all these things." Because actually once you get the diagnosis, it's like you understand yourself so much better. There's been a bit of that for me with the GLP-1. Going on it, I've thought, oh, why did I beat myself up for years? I have spent decades reading books and studying myself and overanalyzing everything and trying to work out why I'm so useless. And then I've gone on this medication which has fixed things that I've realized were beyond my control. And I've spent so long regretting that over the last year. And actually what I realized over the last few weeks is that all of that study and all of that effort has resulted in me molding a mindset where I can actually get completely free of everything. And I am now so grateful to it. I'm so grateful that I spent all this time because particularly when I talk to a lot of people on these medications, so many do not have a healthy mindset because they're not getting any support to do that. But I've no desire to change my body anymore. And that is really, really exciting. And it is a place you can get to. From a very rambly point to one that's less so, I am currently taking 2.5 milligrams of Mounjaro. This is the dose that I've always taken throughout my whole weight loss journey. I intend to stay on it for the long term. Not just because I want to maintain the weight loss, but because I want to maintain the health benefits that I've talked about in my previous videos. And I don't know how to clear up my acne rosacea without the medication. So I'm staying on it. The only negative for me staying on Mounjaro is the cost. And obviously the worry about how do you get hold of it because it's not available through the usual channels for somebody like me on the NHS. But I think it is worth staying on the medication for the amount of benefit that I get. Do I worry about the long-term risks and side effects? Honestly, no. I worry a lot more about how I used to be. I had a lot of health problems in a bigger body that have now cleared up, and those are more threatening to me than the risks of the medication. A common question that I get is, have I ever considered microdosing, particularly because I've mentioned before on this channel that if I miss a dose or I take a dose late, I don't feel any different. I am not going to consider microdosing because on 2.5 milligrams, I get maximum benefit. I have no side effects. I'm living my best life. Why would I try and reduce it? The only reason to reduce it would be to try and save money. And for me, my most important thing is always the health over the money aspect of things. Everyone's allowed to, again, differ in their opinion on that. But when it comes to taking a dose that hasn't been studied and tried and tested, why would I do that when it's not even going to benefit me financially? Because I'm not somebody who's going to use the pen beyond its expiry. There are some people out there who will say use the pen beyond its expiry, it'll be fine. But I don't know how we can say that because we have literally no studies on that. And so in the same way I wouldn't eat moldy food, I'm not going to inject an expired medication. The other thing to bear in mind is that this medication has brought me such incredible benefit that I really want to try and make sure I can take it for as long as possible. And one of the reasons that I might have to stop is if I develop side effects. And if I develop side effects because I've been tweaking and playing with my dose, I'd feel very different about that to if I develop them when I've been taking it as is recommended. The thing that I see people, again, commonly doing when they've been on this medication for longer is people get more confident with it. You get those going from, oh, I can't bring myself to give my first injection, to, oh, let's crack open this pen and do a golden dose. I'm going to change my dosing regime from whatever's recommended to what I saw somebody on the internet say. And people get more confident at tweaking and playing with things. And they keep tweaking and playing with things that we don't need to play with. We should be tweaking and playing with our lifestyle with the support of a GLP-1, not tweaking and playing with the medication to try and obtain a lifestyle. People are using it the wrong way around. And I think some get bored after a few months and start doing this and just get a lot more confident. The other thing is novelty wears off. And for a lot of people in those first few months, you can get rapid weight loss for some. The changes in how you feel are amazing. And then the novelty wears off. And that loss of novelty and that loss of dopamine, I think for some people, results in them feeling like they're not getting progress, even if they're still progressing, just because it doesn't have the same intensity. And so that's why they start doing this stuff. Don't be one of those people. If you are losing, if you are heading towards whatever goal you have with your current regime, you don't need to keep playing around with it. Just let it work. Let it take its time and focus on something else. Because ultimately, we're all going to get to points in our lives where our weight is not the most important thing and we're trying to focus on other things. And so maybe having that lack of intensity sometimes makes your journey much more manageable and realistic in the long term as well. So yeah, for me, I'm staying on it long term. I'm more than happy with that. And that is my personal assessment. I know that won't be the same for everyone. I do find it very interesting that there's no controversy about people taking these long term for type 2 diabetes or lots of other medications that have come out after GLP-1s that people are taking long term, and nobody's worried about the long term side effects of those. It's just the weight management medications. So my weight loss journey is over, and it is so exciting to be moving on to the next thing, which is supporting other people with theirs. And that's what I've been up to over the last few weeks. I sat down with the BBC to give an interview for a documentary they're making on GLP-1s. Now, I'm not sure I was the most coherent at this point because that morning I had spent hours sat down with the medical regulator here in the UK, and they gave me the green light for my own clinic here, which will be an online remote clinic that people can book into, and I can do one-to-one consultations online and support people with weight management and GLP-1s. So I'm really, really excited for that. I'm not opening a pharmacy. It's not actually the medications, it's the consultation and the information and making sure people are doing what's right for them and being able to support them with that. That's what I'm looking to offer, though I have partnered with a lovely little pharmacy that I've found here in Manchester. So if people do want to get their medications through the clinic, that is a possibility as well. So yeah, all the information will be live on the website. The clinic opens its doors on Monday the 20th of October, so that's next week, and obviously those are online virtual doors. The website will be going live this Wednesday, so people can go and have a look at it from then, which I'm really excited for. It will just be so nice to actually work with individuals. And while I've been waiting for the clinic to open over the last few months, I have actually gone back to working in the NHS. So I've been working in an NHS practice, and I picked one that's very innovative. And I've kind of gone back on a scheme where I can do long appointments with patients. So it pays peanuts, but I actually get to do a job I enjoy. But it's been quite heartbreaking going back into the NHS after a few years away, seeing the difference and the deterioration in the standard of care has been quite shocking to me. At the same time, when I'm supporting patients in my private clinic, I want to be able to know what's available on the NHS, how the NHS is actually working, what services are actually running, and how things are going, and also to have that wide view of healthcare. As much as I want my focus to be on obesity, obesity affects so many systems of the body, and being up to date with everything else is so incredibly important. So yeah, that's what I've been doing over the last few weeks. I've been working a few days in the NHS, getting the clinic open, doing lots of things allied to all of this, but it's been really exciting. But yeah, when it comes to my own weight loss journey, I'm done. I do want to share with you more about my running though, because I'm really enjoying that. It makes me very happy. So that is it for today's video. I am done when it comes to the weight loss, and who knows, maybe in the future that will change. Maybe I will suddenly develop side effects, or I'll lose all the benefits, or something will happen. And if it does, I'll share that, because if I'm prepared to share the positive, as we know, I'm more than happy to share the negative as well. So that's really important. And you might think, well, how much have you really been done with the weight loss if you're open-minded to things like that happening in the future? But that's life. There's always twists and turns in life that you don't see coming. People's health can change at any point, and that's something I really have gained an appreciation of with 20 years in healthcare. So all you can ever say is that right now, this is where I'm at, and I am really happy, and I never thought I would have a right now like this.